I'm Dr. Kevin Spencer, and I practice in Austin, Texas. I'm a family practice physician. I'm part of a 9-doctor group. We also employ 8 physician assistants, so we're a 17-provider practice there. We're in the process of building a medical village and a surrounding network, so we're hoping to double the size of our primary care network within the next year to 2 years. We began to look at our business, and in primary care, the amount of data that we manage is enormous. And in order to be able to care for a patient efficiently, it actually made a lot of business sense for us to have an electronic health record to manage things like prescription refills, the drug database, the ability to email and message our patients via our website and the patient portal. So we began to embark on that. At about the same time we did that, the meaningful use funds became available, which was a further incentive to get there more rapidly. So we were able to do that. And then finally, what we've learned shortly after getting in there was the critical importance of the data. As payment reform comes and we need to prove quality, show quality, provide access, to have real value in the medical equation, we now have the data to support that. That's helping us go to payers and the ability to be viable in our market and be really a healthcare leader in our market now. I think the challenge of implementing the electronic health record first is always the cost. That's what you'll hear from every doctor. So I think you have to really look at that and analyze the medical space and the EHR industry and look at what you're going to get on the back end and make your budget. So I think one challenge was just getting physician support within the practice. The second challenge is making sure you have a physician champion. That is critical. If you don't have high physician engagement from the top invested in the project, it shows in the industry that it fails. So I think that's a second challenge. Third would be training. You need to plan that in your budget. You need to plan to have that be a very important upfront piece of the implementation, is that you're going to highly train several staff to be super users and then take the time for end users to be trained across the organization. It pays for itself over and over again on the back end when you implement it and you don't have to slow your practice down, slow your income stream down because you took time to train initially. You know, implementing the electronic health record, those of us who have fought the fight and got over the hump, sometimes will sound pie in the sky to people. But truly, it's changed our practice in every way. It's changed the culture of our practice. It's changed the way people come to work. It's changed patient satisfaction, access. It's changed our quality. We were now able to measure our quality as physicians, and we've watched all of our quality measures begin to go up as we track them and pay attention. And so that's all real. Was it easy? No, but it's all real. And so it's really impacted it. Financially, I think it has impacted us very favorably, but I don't even think we've begun to see the beginnings of that yet, in the ability to participate in some of the pilots and the medical home programs that we're now being asked to participate in. Without this data and the ability to use an electronic health record, we never would have had that chance. So a small 6-doctor practice that's now grown into a 9-doctor practice is actually being asked to be a leader in our part of the state, all because we chose to jump in to the electronic health record world. I would say the biggest takeaway is I was one of the doctors. I was probably one who was the last in my peer group to get a smartphone. And I would say there has been resistance and a wonderment of, is this really going to happen? And the takeaway I would leave you with is yes, it is here, it's started, and it's going to happen. There will be close to 100% of us practicing an electronic health record, I believe, within the next 5 years. So I think it's time now to do it. So I think that's a takeaway. And the second is something I echoed previously, and that is, if you're not a physician champion, find one. Encourage that person. Find one and do it, because that's in my estimation, one of the critical keys to your success at implementing it.